During pregnancy, many changes will occur in your body. Some of the biggest changes affect your abdominal wall as your body changes to accommodate your growing baby. Many people understand their abdominal wall as consisting of their six-pack muscles or rectus abdominis only. However, your abdominal wall is made up of 4 layers of muscle, all of which play an important role in supporting you and your growing baby. Your six-pack muscle is made up of 2 bands of muscles, each with 4 segments of muscle fibres, which give the muscles the six-pack look. In between the 2 bands lies a fascial structure similar to a tendon called the linea alba. During pregnancy, a hormone called relaxin changes the structure of your tendons and allows the linea alba to stretch, which gives your baby room to grow. The stretching of the fascia is called a rectus abdominis diastasis, or an RAD. This is also known as diastasis recti abdominis, DRA, or diastasis rectus abdominis muscle, DRAM. This is a normal change that almost all pregnant women will experience. Research has shown that close to 100% of women will have an RAD in their final weeks of pregnancy. The average width is about 6.7 centimetres, just above your belly button at this stage. Once your baby is born, the RAD is often more noticeable, and many new mothers become concerned. However, RAD is normal postpartum and will reduce with time and good management. There is a natural period of recovery in the first 8 weeks after delivery, and for 48% of women, the RAD will reduce to within normal range during this time. For the other 52% of women, the RAD will still significantly reduce, with an average width of 2.7 centimetres during this time. Recovery of your RAD will continue up to 6 months postpartum and potentially beyond. At 6 months after delivery, RAD persists in 39% of women. However, the average width is 2.2 centimetres, which is very close to normal. If you or your GP are concerned about your abdominal muscles, you may choose to visit a women's health physiotherapist who can measure the width of your RAD while you perform a chest lift. The physiotherapist may tell you that your RAD is wider in some places and narrower in others. This is also normal. Generally, the RAD is widest just above the belly button, but it is different for everyone. When your physiotherapist is feeling for your RAD, the depth and tension of the linea alba, the fascia in between, is just as important as the width of the RAD. You can also self-assess your RAD to track your progress after your baby is born. Start by lying on your back with your knees bent to about 90 degrees. Place your second and third fingers on your belly just above your belly button like this, and feel for the 2 edges of your muscles on either side of the RAD. Take note of the number of fingers that fit into that space when you are relaxed. Place your other hand behind your head and slowly lift your head and chest off the floor, ensuring your shoulder blades clear the floor. Feel for the 2 edges of your muscles again, just as you start to lift your head off the floor, and note how many fingers fit into the space now. You can then measure your fingers to determine the exact measurement. Be sure to only self-assess once a week at most. There are a few ways to manage your RAD and help your abdominal wall recover. One of the best ways to promote overall recovery is with light exercise. While abdominal exercises are important for the recovery of your RAD, it has been shown that aerobic exercise plays a role as well. The American College of Obstetricians and Gynecologists recommend that after giving birth, women should be performing moderate intensity exercises for 150 minutes per week, broken into smaller sessions daily. Aerobic exercise includes brisk walking or cycling on level surfaces. You are working at the correct intensity if you can hold a conversation but not sing a song. During pregnancy, it was not recommended that you perform intense abdominal exercises because it often causes doming through the stretched tendon. Doming occurs when your abdominal contents put pressure on the stretched linea alba and give the appearance of a bulge through your RAD. This can still occur after your baby is born and is a sign that you are working too hard or incorrectly through your abdominal muscles. Try altering your movements or activities to avoid doming. Here are some examples of safe abdominal exercises you can try at home. Pelvic tilts exercise. Start on your back with your knees bent. Activate your pelvic floor muscles and draw your lower abdominals in. Tilt your pelvis towards you like you are tucking your tail underneath you. Relax and allow your pelvis to return to neutral, ensuring there is a small gap between your lower back and the floor when you are finished. Try to avoid arching your back off the floor when performing this exercise. Standing pelvic tilts. This exercise can also be performed in standing. Practice softening your knees and tucking your tail underneath you. Then reverse the curve and stick your tail out. Remember to come back to a neutral spine at the end of each repetition. The tabletop position. Many abdominal exercises start in tabletop position. When starting in tabletop, ensure that you draw your lower abdominal and pelvic floor muscles in to keep your body steady. Avoid arching through your back as you lift your legs off the floor. Leg slides exercise. Start by lying on your back with your knees bent. Activate your pelvic floor and your lower abdominal muscles. Slide one leg away until it is straight on the floor while keeping your body still. Slide the leg back to its bent position. Repeat on the other side. Avoid arching through your lower back or bulging through the abdomen in this exercise. Bird dog exercise. Start on your hands and knees, activate your pelvic floor muscles and draw your lower abdominals in. Gently reach out with one leg and the opposite arm, keeping your trunk steady. This activates your deep layer of oblique abdominal muscles. When performing this exercise, try to avoid letting your hips drift from side to side like this. If you would like more ideas for postnatal exercise, refer to the King Edward Memorial Hospital postnatal exercise video series on our website. Be aware of the role of your abdominal muscles in everyday activities as well. If you notice doming during your daily routine, try to draw in your lower abdominal muscles and activate your pelvic floor. If you have a toddler at home, encourage them to do as much as they can while you are still recovering. In the early phase postpartum, it is recommended that you try to avoid lifting anything too heavy. For housework, try to carry several smaller loads rather than one large load, and keep objects close to your body when carrying them. When picking baby up off the floor, it is a good idea to go through a kneeling position like this. Rolling baby onto their side makes it easier for you and promotes baby's movement development. When getting out of bed, avoid moving through a sit-up action as this places lots of load through your muscles. Instead, try rolling onto your side and pushing up through your arms to sit on the edge of the bed. Another management strategy for your RAD is wearing support garments, like pregnancy shorts, in the early phase after delivery. If you have trouble finding pregnancy shorts, alternatives include high-waisted supportive underwear, shapewear, and tubie grip. For whichever garment you choose, it is important that it's comfortable, supports your abdomen, and allows you to breathe easily. There is little scientific evidence that supports the use of pregnancy shorts to promote the recovery of an RAD. However, many physiotherapists and postpartum women find support garments beneficial in conjunction with exercise in the early stages postpartum. Like many other medical conditions, searching for answers on the internet does not always yield the best results about RAD. There are many misconceptions about RAD found in unreliable sources. Here are some of the common myths. 1. An RAD will cause incontinence. False. Research has shown that women with an RAD after delivery are not more likely to suffer from a weakened pelvic floor or urinary incontinence compared with women without an RAD. While it is common for women to have some form of urinary incontinence after birth, this is attributed to the stretching of the pelvic nerves and muscles during labour, and the incontinence will usually resolve with pelvic floor muscle exercises. Myth 2. An RAD will cause low back pain. False. It was initially thought that an RAD would change the function of the abdominal muscles and leave your lower back unsupported. And while many women experience back pain during and after pregnancy, the research has shown that women without an RAD postpartum are just as likely to suffer from back pain as those with an RAD. Myth 3. It's all about the width of your RAD. False. While the width of the space is important in determining the severity of an RAD, it has been shown that the depth and tension of the linea alba is equally important. In some cases, even if an RAD is more than 2 centimetres wide, if the connective tissue in the space is firm and holding tension, it may not be considered as severe. Myth 4. Surgery is the only way to truly fix the gap. False. Studies have shown that time in conjunction with exercise and support garments can effectively decrease the width of the gap without surgical intervention. Myth number 5. You must wait 6 weeks before starting exercise. False. According to the Royal Australian and New Zealand College of Obstetricians and Gynecologists, women with good general health and an uncomplicated delivery can begin exercise several days after delivery when they feel able to. It is recommended that women start with simple stretches of their legs and back muscles, as well as strengthening exercises for their lower abdominal and pelvic floor muscles. Walking is also recommended with the gradual progression to moderate intensity aerobic exercise. In conclusion, many women are concerned about the appearance of their abdominal wall after pregnancy. However, it is important to remember that it took your body several months to change and accommodate your growing baby, so it may take a little while to return to the way it was before you were pregnant. Be patient with your body. If you have any concerns about your recovery, don't hesitate to seek help from your specialist, GP, or women's health physiotherapist.